Hello everyone. In today's video, we are going to learn norma lateralis, that is the lateral view of the skull. So first of all, we'll see what all bones are present in norma lateralis. From starting from the anterior portion, this bone here is the frontal bone. This green colored bone is the parietal bone. This is the occipital bone, the temporal bone. This is the greater wing of sphenoid. Zygomatic bone, maxilla, mandible, and this is the nasal bone. So these all bones we can see in norma lateralis. First is the frontal bone, then parietal bone, occipital bone. Coming downwards is the temporal bone, greater wing of sphenoid, zygomatic bone, nasal bone, maxilla, and mandible. Coming to features of norma lateralis. So first one is the temporal lines. We have already studied temporal lines in norma verticalis. Here we can see that the temporal lines, they start from the zygomatic process of frontal bone, then they cross the coronoid suture, which is the suture which is present between frontal and the parietal bone. Here they divides into two, that is the superior temporal line and the other one is the inferior temporal line. The superior temporal line, it goes backwards and then it fades away in the parietal bone, and the inferior temporal line, it goes downwards and then forwards towards the squamous temporal bone, and it gets continuous with the supramastoid crest. This region of the supramastoid crest, which is present near the junction of squamous and mastoid part of temporal bone, is the supramastoid crest. So the inferior temporal line, it goes forwards and downwards and it gets continuous with the supramastoid crest. So this is about the temporal lines. The next feature is the zygomatic arch. So basically, zygomatic arch, this structure which is seen in the side of the skull, is the zygomatic arch. It is a bar-like structure which is present slightly distant and laterally to the skull. This is the zygomatic arch and it is present on both the sides. So we can say that zygomatic arch is a horizontal bar-like structure on the side of the skull, which is present in front of the ear. This is the external acoustic matrix which is present in front of this and little above the tragus. Now, the zygomatic arch is formed by two bones. This is the zygomatic bone and this is the temporal bone. So, this one is the temporal process of zygomatic bone and this is the zygomatic process of temporal bone. So, the anterior 1/3 of the zygomatic arch is formed by temporal process of zygomatic bone, and the posterior 2/3 of the zygomatic arch is formed by the zygomatic process of temporal bone. In between, there is presence of a suture which is called as zygomatico-temporal suture. It runs downwards and backwards. Now, the arch is separated from the skull by a little gap. So here, this arch is separated from the surface of the skull by a little gap. There is presence of a gap. The lateral surface of the zygomatic arch is covered by it is subcutaneous. Basically, it is covered by skin. So the lateral surface is subcutaneous. Then coming to anterior end of the upper border of the zygomatic arch. This is the upper border of the zygomatic arch and the anterior end or this point of the anterior end of the upper border of zygomatic arch is called as the jugal point. Now coming to the posterior end. So in the posterior end, the zygomatic arch, it attaches to the squamous temporal bone by two roots. First is the anterior root. This is the anterior root, and which goes posteriorly. This one is the posterior root. This is the squamous temporal bone. So zygomatic arch, it attaches to the squamous temporal bone by two roots. First one is the anterior root, this, and the second is the posterior root. So the anterior root, this portion, it passes medially in front of the articular fossa. This portion is the articular fossa of temporomandibular joint. So this anterior root, it passes medially and anterior to the articular fossa. Here it forms an elevation. This elevation is called as articular tubercle. And the posterior root, the second root, this one, which goes more posteriorly, which runs lateral to the mandibular fossa and above the external acoustic meatus, and it goes posteriorly and gets continuous with the supramastoid crest. This is the supramastoid crest. So this portion of the zygomatic arch, this is the posterior root of zygoma. It passes backwards along the lateral margin of mandibular fossa. This is the mandibular fossa. So along the lateral margin of mandibular fossa and above the external acoustic meatus, and it gets continuous with the supramastoid crest here. So basically we can see here also, this is the zygomatic arch, this is the anterior 1/3 and this is the posterior 2/3 of the zygomatic arch. When it comes here in the posterior end, it forms the anterior root of zygoma, and here the elevation which is formed in the lower border of the zygomatic arch is the articular tubercle, and then it goes posterior to the mandibular fossa. Here also it forms a projection which is called as post-glenoid tubercle. So this one is the articular tubercle, and here the projection, the bony projection, is the post-glenoid tubercle. So the zygomatic arch, it when it attaches posteriorly to the squamous temporal bone, it has two roots. First is the anterior root of zygoma, and second is the posterior root of zygoma. Now coming to external acoustic meatus. So this is the squamous temporal bone. This is the mastoid temporal bone. And this portion is the external acoustic meatus. So we are talking about this. So external acoustic meatus, it opens just below the posterior root of zygoma, as we have seen that here is the anterior root of zygoma and here is the posterior root of zygoma. So external acoustic meatus is present below the posterior root of zygoma. Then the anterior margin, the inferior margin, and some part of the posterior margin of external acoustic meatus is formed by the tympanic plate. The posterior superior portion, this posterior and superior portion, it is continuous with the squamous temporal bone, as we have seen that this portion is the squamous temporal bone, so it is continuous with the squamous temporal bone. The margins of the external acoustic meatus are rough because there is attachment of auricular cartilage around this. So the margins all around of external acoustic meatus are rough. So these now coming to the suprameatal triangle. There is a small depression, triangular depression, which is present just posterior superior to the external acoustic meatus. This triangle is called as suprameatal triangle. So the suprameatal triangle above above it is formed by the supramastoid crest. As we have seen that the posterior root of zygoma gets continuous with the supramastoid crest, a bony elevation which is present posterior to this. So above it is formed by supramastoid crest. In front it is formed by the posterior superior margin of the external acoustic meatus. This is the external acoustic meatus. This is posterior and superior margin of the external acoustic meatus. And behind this triangle is formed by vertical tangent to the posterior surface of posterior boundary of meatus. So this is the posterior boundary of meatus, and when we draw a vertical tangent from here to here, this portion, this is the posterior margin of the suprameatal triangle. So this area, a depression which is present posterior superior to external acoustic meatus is called as suprameatal triangle. Now coming to mastoid temporal bone. So the part of temporal bone, this is the temporal bone, this is squamous temporal bone. And the part of the temporal bone which is present just behind the external acoustic meatus, this portion is the mastoid temporal bone. Anterosuperiorly in this region, it is continuous with the squamous temporal bone. And the suture which is present between squamous temporal bone and mastoid temporal bone is the squamomastoid suture. This is the squamomastoid suture, and this is partially obliterated in adult skull, but it may be visible. Then this mastoid part of temporal bone where it meets the parietal bone, this area. This is the parietal bone. So where this mastoid temporal meets the parietal bone, this suture is called as parietomastoid suture. And the mastoid bone where it meets the occipital bone, this is the occipital bone. So the mastoid temporal bone where it meets the occipital bone, this portion of the suture is called as occipitomastoid suture. And as we all know that the suture which is present between parietal and occipital bone is called as lambdoid suture. So these three sutures meet at a point. This parietomastoid suture, this occipitomastoid suture, and this lambdoid suture. They meet at a point here. This point is called as asterion. Asterion. So in infants, this asterion is the site of a fontanelle, which is the mastoid fontanelle. It closes at the end of the first year, and as the skull develops, the mastoid fontanelle, it gets obliterated, and this point where all these three sutures meet is called as asterion. Coming to mastoid process, it is a projection. It is a projection of the mastoid temporal bone, of the lower part of the temporal bone. It is present posterior inferior to the external acoustic meatus, and it appears during the development. It appears during the second year of life. Then in the anterior aspect of base of mastoid process here, between the tympanic plate and the mastoid temporal bone, there is presence of a fissure which is called as the tympanomastoid fissure. Here a fissure is present which is called as the tympanomastoid fissure. And near the occipitomastoid suture, here the between the occipital and the mastoid bone, near the occipitomastoid suture, there is presence of a foramen which is called as mastoid foramen. This mastoid foramen, sometimes it is present at the occipitomastoid suture and sometimes it might present in the occipital bone also. So this is the mastoid temporal bone. Next feature is the styloid process. So this portion is the styloid process. This is a needle-like projection which is present anteromedial to the mastoid process. So this is the mastoid process, and anteromedial to this process there is a needle-like projection which is called as styloid process. It is directed downwards, forwards and slightly medially. That means towards the sagittal surface of the skull medially. Then the base of this styloid process, it is partly covered with the tympanic plate. So this is the tympanic plate of external acoustic meatus, and the base is partially covered by tympanic plate of the temporal bone. And the tip of this styloid process is present somewhere here. It is hidden by the border, the posterior border of the ramus of the mandible. So this is the styloid process. Coming to temporal fossa, this green colored area which is present mostly in the temporal bone, this area, this is a slight depression, is the temporal fossa. The boundaries of temporal fossa, above it is lined by the temporal lines. As we all know that there are two temporal lines, superior and inferior temporal lines. So the above the superior boundary of temporal fossa is formed by temporal line. Then below it is lined by the upper border of zygomatic arch and the infratemporal crest of greater wing of sphenoid. So this is the greater wing of sphenoid. Infratemporal crest of greater wing of sphenoid. It forms the medial portion of the lower border of temporal fossa. Then anterior wall. The anterior wall is formed by zygomatic bone. This portion is the zygomatic bone. This is the zygomatic bone, frontal process of zygomatic bone. So the anterior wall is formed by zygomatic bone, a small portion of the frontal bone, and medially there is also presence of sphenoid bone in the anterior wall of the temporal fossa. This anterior wall of the temporal fossa, it separates the fossa from the orbit. Here it is the orbit. So this anterior wall separates the fossa from the orbit. Then floor. The anterior part of the floor, this is the floor, whole is the floor of the temporal fossa. So in anterior part of the floor of temporal fossa, a H-shaped structure is present by the sutures. So this area is the junction of four bones. This is the frontal bone, this is the sphenoid bone, the temporal bone and parietal bone. These four bones, they meet at this area, and this H-shaped region is called as terion. This is called as terion. So this terion is basically present 4 centimeter above the middle point of zygomatic process and 2 centimeter behind the frontozygomatic suture. This is the frontozygomatic suture. 2.5 centimeters behind this frontozygomatic suture is the terion, and 4 centimeter above the midpoint of zygomatic arch. So what is the clinical significance of terion? Deep to the terion lies middle meningeal vein, anterior division of middle meningeal artery, and stem of lateral sulcus of brain. Coming to the last feature of norma lateralis is infratemporal fossa. So this portion is the temporal fossa, and below this temporal fossa, behind the zygomatic arch, there is presence of a depression which is called as infratemporal fossa. So this purple colored area depicts the infratemporal fossa. Now, if we remove the zygomatic arch from here, there is a depression in somewhat this region. This is the region of infratemporal fossa. So the roof of the infratemporal fossa, mesially, it is formed by the infratemporal surface of greater wing of sphenoid. Greater wing of sphenoid is this, or infratemporal surface of greater wing of sphenoid, and small part of the squamous temporal bone. So roof is formed by small part of squamous temporal bone and infratemporal surface of greater wing of sphenoid. Laterally, the roof is incomplete because the infratemporal fossa, it communicates with the temporal fossa laterally through the space just deep to the zygomatic arch. So roof is formed by greater wing when where there is presence of greater wing of sphenoid. In the roof of infratemporal fossa, there is presence of two foramen, that is the foramen ovale and foramen spinosum. We can see it in the in norma basalis clearly. Then floor of the infratemporal fossa is open. The medial wall is formed by the lateral pterygoid plate and the pyramidal process of palatine bone inferiorly. So medial wall is formed by these two things. First is the lateral pterygoid plate, and second is the pyramidal process of palatine bone. Then lateral wall is formed by ramus of the mandible. So this is the ramus of the mandible. So the inner surface of ramus of the mandible forms the lateral wall of the infratemporal fossa. Anterior wall of infratemporal fossa is formed by posterior surface of maxilla. This is the posterior surface of maxilla, and medial surface of zygomatic bone. So this is the zygomatic bone. The inner surface of here which surface is present, the inner surface of zygomatic bone, it also contributes to forming the anterior wall of infratemporal fossa. So we can say that the roof is formed by infratemporal surface of greater wing of sphenoid and some part of squamous temporal bone. Here we can see the sphenoid and squamous temporal bone. Then the floor is open. The medial wall is formed by lateral pterygoid plate and pyramidal process of palatine bone. The lateral wall is formed by the ramus of the mandible, the inner surface of the ramus of the mandible. The anterior wall is formed by the posterior surface of maxilla and medial surface of zygomatic bone. Then the anterior walls, these are the anterior walls, and the medial wall. Medial wall is the lateral pterygoid plate. These are separated by a fissure, that is the pterygomaxillary fissure. This triangular shaped area which is open is the pterygomaxillary fissure. Through this pterygomaxillary fissure, this triangular shaped area, through this pterygomaxillary fissure, the infratemporal fossa communicates with the pterygopalatine fossa, which is present more medially. And the upper end of pterygomaxillary fissure, this portion, it is continuous with the inferior orbital fissure. This is the inferior orbital fissure. So through this communication, the infratemporal fossa, it 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 communicates with the orbit. So this is the pterygomaxillary fissure which separates the anterior wall and the medial wall of infratemporal fossa. And through this pterygomaxillary fissure, the infratemporal fossa communicates with pterygopalatine fossa, which is present more medially to this. And the upper part of pterygomaxillary fissure, it is continuous with the inferior orbital fissure through which the infratemporal fossa communicates with the orbit. So with this, we come to the end of all the features of norma lateralis, and in next video, we'll be seeing the muscle attachments of norma lateralis. Thank you.